Flu care for the elderly. A cold or the flu can be especially risky for people over age 65 because they are more likely than younger adults to develop life-threatening complications. Colds and the flu are contagious viral illnesses that spread primarily through the release of viral particles when an infected person sneezes or coughs. The illnesses can also be contracted by touching a virus-contaminated object and then transferring the germs to your eyes, nose, or mouth. It's important to prevent viral infections in the elderly because treatment options are limited. Hospitalization may be necessary if complications occur. Vaccination. The flu or influenza is a significant health threat to the elderly. Between 1976 and 2007, nearly 90% of the deaths from influenza occurred in people 65 or older, according to the National Foundation for Infectious Diseases. The best way to prevent the flu is to be vaccinated every year, recommends the Centers for Disease Control and Prevention. Administration of flu shots. Flu shots for seniors are administered by injection into a muscle. The regular flu vaccine is suitable for anyone over the age of 6 months. A higher dose vaccine was made available beginning with the 2010-2011 flu season to stimulate a better immune response in older adults. Studies had confirmed an improved immune response in the elderly with the high-dose flu vaccine. It is unclear, however, whether the augmented immune response translates into better protection against the flu. Additional precautions. Even people who have been vaccinated need additional protection from getting the flu or a cold. It takes about 2 weeks to develop immunity to the flu after vaccination, and there is no vaccine to protect against the common cold. Preventive measures. Preventive measures should include using a paper towel or tissue when turning doorknobs in public places, wiping down telephone receivers, and washing hands frequently. Because infected people can spread cold and flu viruses before they have symptoms, elderly people should consider avoiding crowded places when the risk of exposure is high. Houses with children. Those who live in households with children should be especially cautious because youngsters are less likely than adults to cover their mouths when coughing or sneezing. Frail, older people may want to wear a protective mask when coming in contact with infected or potentially infected visitors and family members. Other factors. While advanced age may be a factor in decreased immunity, other possible causes for the reduced response to flu vaccines may include loneliness, depression, stress, isolation, and lack of social support often experienced by elderly caregivers. To boost their immune responses, elders in caregiving situations might consider exercising and taking appropriate measures to increase emotional support and reduce stress. Medications. 2 types of antiviral medications are available to treat the flu in elderly people who are not vaccinated or were not sufficiently protected by the vaccine. These medications must be administered within the first 48 hours after symptoms appear. If you like our video, please share and subscribe on our YouTube channel.